Causes of bronchiolitis in babies.
So the commonest causes of bronchiolitis are viral infections. We have umpteen viruses which can cause bronchiolitis, from neonates to infants to toddlers. So the most commonest cause that is found all around the world is respiratory syncytial virus, which accounts to almost 50 to 60% of the cases. Apart from respiratory syncytial virus, there are other viruses called as rhinovirus, metapneumovirus, Boca virus, influenza, parainfluenza virus, and sometimes some atypical organisms like Mycoplasma pneumoniae, Legionella pneumophilia, or Chlamydia psittacosis, which can lead to bronchiolitis in children less than 2 years of age. So most commonest is viral, and most commonest is during the season, that is between June to July up to February in Bangalore's climatic condition. But if you take it in India as a whole, as soon as the winter sets in, the rise in cases of bronchiolitis usually coincides with either RSV infection becoming higher, or influenza, or what we colloquially call it as flu, is very common.
Symptoms of bronchiolitis in babies.
So usually babies, that is neonates less than 30 days, infants up to 1 year, and toddlers up to 2 years of age usually come to us with mild bronchiolitis. So we classify bronchiolitis as mild, moderate, and severe. So children who have bronchiolitis usually start off with something called as coryzal symptoms. Coryzal symptoms is something like slight fever, a little bit of running nose, a little bit of blocked nose, and they have a little bit of breathing difficulty. It can be again mild, moderate, severe. So children usually start off with mild fever, but fever might not be that significantly higher. But in children who develop RSV infection, that is respiratory syncytial viral infection, or adenoviral infection, or flu infections, can have very high grade fever spikes. Apart from that, nose block, runny nose, a few children also have sore throat, and some children have breathlessness. These are the commonest symptoms. So depending on these, we grade them into mild, moderate, severe, and depending on that, the treatment actually applies. So usually when do we call children have mild bronchiolitis? Mild bronchiolitis, usually the criteria we use are respiratory rate. That is, if you are able to look at your child and look at the child when the child is breathing comfortably, that is what is respiratory rate. So always the tips that we give to the mothers are, one is keep your hand on the tummy of the child when the child is actually asleep, and count the breath, that is respiratory rate, for 1 whole minute. Do not count for 15 seconds, do not count for 30 seconds, and multiply by 4 or multiply by 2 respectively. Count it for a whole 1 minute. Normally in infants, usually less than 3 months of age, it should not be more than 40 per minute. Anything between 40 to 50 is called as mild, anything between 50 to 60 is called as moderate, and anything more than 60 is called as severe.